Okay, let's dive right into this. Have you ever looked at an X-ray at the vet's office and wondered how they actually get those glowing, translucent images of bones and tissue? Or, maybe, more importantly, have you ever wondered what happens when things go completely, horribly wrong? Well, welcome to this explainer. Today we're going to uncover the magic and, honestly, the super common mistakes behind veterinary radiography. We'll explore exactly what makes a perfect image, and then we're going to put on our detective hats to diagnose some of the wildest visual faults that can totally ruin a shot. So, here's our game plan for today's medical detective training. First, we'll look at the anatomy of a perfect X-ray. 2. Mastering density and contrast. 3. The rogues gallery of faults. 4. Chemical and processing errors. And finally, 5. Handling and setup mistakes. Let's get to it.
All right, starting right off with Section 1. Anatomy of a perfect X-ray.
So, the primary goal of any radiograph is obtaining as much diagnostic information as possible about a patient's internal structures, right? Because if the image isn't clear, the vet literally cannot make a diagnosis. It is as simple as that. To achieve that goal, our ultimate baseline metric for success is what we call radiographic detail. You might also hear it called recorded detail, or if you're in the digital world, spatial resolution. Ultimately, this is just the amount of fine structure you can physically see on the image. And this detail, it isn't just magic. It's strictly controlled by 3 key factors: radiographic density, contrast, and overall geometric sharpness. When all 3 of those align perfectly, you get a beautiful, highly readable image. Just look at the difference here. This brilliantly illustrates what we're aiming for. Up top, the image is super hazy, right? The edges of the bones kind of blend together, and it completely lacks that crisp spatial resolution. You can barely make out the fine joint spaces. But now, look at the bottom image. The fine structures of those carpal bones are incredibly sharp and highly readable. If you're a doctor trying to spot a tiny hairline fracture, you absolutely 100% need the clarity of that bottom image.
Moving right along to Section 2. Mastering density and contrast.
Getting these factors right is basically a Goldilocks situation. You have to find a balance that's just right. So let's break down density first. Radiographic density is defined as the degree of blackness or darkness on a radiograph. You see, when you're looking at the black areas on a developed film, what you're actually looking at are tiny deposits of metallic silver left in the film emulsion after it's exposed to X-rays and processed. But here's what's absolutely crucial to remember. Radiographic density is inversely proportional to the tissue density being radiographed, meaning thicker, denser body parts absorb way more X-rays, which ironically leaves you with a much lighter image on your film. And when that density is off, you completely lose your diagnostic power. The primary technical causes of these density faults come straight down to the machine's settings. If your MAS or KVP, which, by the way, dictate the total number and penetrating power of the X-rays, if those are too low, you get underexposure. If those settings are too high, you guessed it, you get overexposure. It's a really delicate balancing act. Notice how vividly these machine errors present themselves. On the left, we have this severe bright white radiograph. This underexposure happens when your settings are too low, sure, but what's really interesting is that it also happens if you just underestimate the physical measurement of the animal's body part. Or, if your focal film distance, that's the distance between the X-ray tube and the film, is too high. On the right, we have a super dark, overexposed radiograph. Here, the settings were too high, the body part was overestimated, where that focal film distance was just too short. In both scenarios, the internal organs are literally lost to us.
Now, density's partner in crime is contrast. Radiographic contrast is simply the density difference between 2 adjacent areas on your image. Take a look at the image on the far left. That is high contrast, or what we call a short scale of contrast. It's basically just stark black and white with zero subtlety. The middle one is low contrast, looking totally washed out. But that image on the right, that is optimum contrast. It gives you the perfect, readable scale of block, white, and all those necessary gray tones in between so you can actually see the tissues properly.
All right, Section 3. The rogues gallery of faults. Let's see how this all builds together when things go south.
So imagine this. You process a film, slap it up on the lightbox, and you see this completely confusing, overlapping phantom image that makes absolutely zero anatomical sense. What in the world caused that?
Yep, this is a classic double exposure artifact. You can clearly see a canine abdomen superimposed right on top of another, totally separate image. This usually comes down to simple human error, honestly. A film was exposed, forgotten about, not developed, and then inadvertently loaded and exposed a second time with a different patient or body part. The whole shebang results in a film that's way darker than a normal exposure and obviously completely useless for a diagnosis.
Another massive culprit in our rogues gallery, motion blur. The crucial point here is this: you could have the most perfect machine settings in the world, but they won't save you if there's movement during the exposure. Patient motion is the biggest offender by far, especially from non-sedated animals or dogs that are panting heavily. But hey, human error plays a big role too. Hand-holding cassettes or accidentally bumping the X-ray tube will instantly destroy that spatial resolution we worked so hard for. The best fix? Honestly, sedating the animal and using proper restraint.
Okay, let's step off the clinic floor and into the darkroom for Section 4, Chemical and Processing Errors.
Check out these wild horizontal bands. This is literally what happens when development chemicals aren't stirred properly before use or when the chemical levels are just completely uneven in the tank. The top band of this film wasn't exposed to X-rays, was developed but wasn't fixed. Further down, you have areas that were exposed, developed, and fixed perfectly fine. It's a striking visual that physically demonstrates exactly what happens when the liquid levels of your processing chemicals are neglected.
Then there's a radiographic fog. Fog is basically this super annoying, unwanted gray density that completely kills your contrast, and the causes for it are literally everywhere. If your storage room is hotter than 68 degrees Fahrenheit, fog. If your humidity is outside that sweet spot of 30 to 50%, fog. It can happen from light sneaking into your darkroom, a safe light sitting a little too close to the counter, or simply leaving the film in the developer for too long.
And finally, Section 5, Handling and Setup Mistakes.
Let's wrap up our detective work with the physical handling of the film itself. Believe it or not, static electricity is a huge enemy here. When you mishandle the film, electrons can pass right onto it, and they literally expose the film without a single X-ray ever being fired. It creates these distinct black marks that look like smudges, or even these crazy dramatic lightning strike tree patterns right across the image. It's an incredibly common issue, especially if you're working in a cold, dry climate.
Luckily, the fix for this is super actionable. To stop those tree-like artifacts, you just need to maintain moderate humidity in your darkroom. And, more importantly, never ever slide the film across surfaces. That friction is exactly what excites the electrons. Finally, just give your screens a regular clean with an anti-static agent. It's such a simple step to ensure a tiny static shock doesn't completely ruin a complex medical procedure.
So there we have it. Having decoded the anatomy of a perfect image and explored all the crazy ways density, contrast, chemistry, and even a little static electricity can mess it up, you've got a whole new perspective. Every visual fault on an X-ray isn't just a ruined picture. It's a very specific set of clues just waiting for a medical detective to solve them. With all that in your toolkit, will you ever look at a blurry or double-exposed X-ray the same way again? Thanks so much for joining me on this explainer, and remember to always keep looking closely.